and a boardwalk leading to it for the children's outdoor activities. There was no money in the budget to accomplish this project. Over the years, the dads of the preschoolers have done maintenance such as fence mending, spreading loads of pea stone, and much more. But stepping up to the plate, the dads contacted local businesses. Materials and labour were donated by the following businesses and organizations: Elmsdale Lumber, Elmsdale Rona, Shubenacadie Home Hardware, Dartmouth Kents, and Goodfellows. The fathers met the construction challenge, and the building work was done the first weekend in August. Mr. Speaker, volunteers and community spirit are what makes East Hants strong. When a community comes together, amazing things can be accomplished, even in a weekend. I would like to thank all those involved, Mr. Speaker.
Thank you very much. Just like to take a minute to remind everybody to, again, not refer to constituents directly, but direct your comments through the chair. And also not to use member statements as a commercial for community events. That's important as well. And also remind members not to cross between the speaker's dais and whoever on the floor is speaking. We'll now move on to oral questions put by members to ministers. The House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. As we're trying to understand the whole issue of the Canada Health transfers and what's going on in our healthcare system, one side, we have the federal minister saying that she doesn't know where the money is going that's being received by provinces. On the other hand, the Nova Scotia Health Authority had to borrow $7 million from their restricted funds to make payroll when the Department of Health and Wellness owed them over $70 million. In addition, the Auditor General has identified an $85 million budget shortfall for urgent infrastructure funding, and now, because of failed negotiations, our health minister says we must make $26 million in cuts to our health care budget. So my question to the minister is, what has the department done with the funds that it receives from the Canada Health transfers?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and to respond to the member's question and to let all Nova Scotians know is that the over $900 million that comes from Ottawa through the health transfer, every cent of that goes into the operations, the $4.2 billion to run our healthcare system, and we all know that it only makes up about 20% of the total cost of running the system, and this is why it's of great concern to all Nova Scotians that we continue to work with the Premier, with the Prime Minister, to keep the escalator at the 6%.
The Honourable House Leader for the Official Opposition.
Well, we know, Mr. Speaker, that cutting $26 million, even though it's a small percentage of that total health budget, that it is still a phenomenal amount of programs available in Nova Scotians, whether it's finding doctors, whether it's going into long-term care help, whether it's trying to find ways to make our emergency rooms more effective. So the federal minister is asking that that be attached to innovation, trying to find good new healthcare solutions, not trying to do the things that we've done before. Nova Scotia's Auditor General has called our healthcare system not sustainable, and major changes are needed. Costs and demands for services continue to rise with no relief in sight. My question to the minister, that will he admit that there is a problem in our deteriorating healthcare system, and will he secure proper funding for Nova Scotians with innovation that the federal minister wants?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and pleased, of course, to convey to the House and all Nova Scotians that, in fact, the federal minister, Dr. Jane Philpott, joined the Premier and I to announce My Health NS, which is a personal medical electronic record that's going to be a great boost to Nova Scotians, because it will give us direct information from doctors and reduce the number of visits required to physicians and other primary care providers, and get more people in front of doctors when they need to be seen.
The Honourable Leader in the House for the New Democratic Party.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Premier. We know that the government's we know that Nova Scotia's population is aging, and we know that wait times for nursing homes beds range from 62 days in Shelburne to 1,083 days in Richmond. Last year, this government cut $3.6 million from the operating budgets of long-term care facilities. This year, they made more than $3.4 million in cuts to long-term care facilities. And yet, in the throne speech, the government said long-term care is one of their priorities. Mr. Speaker, if the priority is for this government, can the Premier explain why he decided to balance the budget by cutting long-term care?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to thank the honourable member for the question and thank all those across our province who work in long-term care. Mr. Speaker, look after our parents, our grandparents, our siblings, Mr. Speaker, when required that service. We believe that we have enough money on the table, Mr. Speaker, that allows those services to be provided. This was brought up yesterday by the official opposition, raised the issue about a nursing home here in town. We have an auditor that's gone in to have a look, Mr. Speaker, to see if there's a difference of opinion on where that money is being spent to come through. If there are changes, adjustments to that required, Mr. Speaker, I've made it clear that we'll be happy to make those adjustments.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, when the government made these cuts, a letter was sent from the Department of Health and Wellness directing facilities to maintain programming and staffing levels, despite a 1% cut in fundings for the second year in a row. The letter, dated April 20th, 2016, says, and I quote, "Services and programs to residents should not, I repeat, should not be negatively impacted in services delivered. Staffing levels should not be reduced," and I will table that. So, Mr. Speaker, how did the Premier expect long-term care facilities to absorb a cut of more than $6 million without impacting staff, food, and programming?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question, Mr. Speaker. We have continued to work with our partners across the province when it came to make sure that our seniors have the proper care in place. We send in nutritionists, Mr. Speaker, to make sure the food that is being served to citizens is of the quality that all of us would expect, and all of them there, Mr. Speaker, make sure it's happening. We continue to work with them. If there are issues, as I said to you earlier, Mr. Speaker, we're happy to hear from those nursing homes to work through those challenges, but we believe there is enough funding on the table to deliver those services without impacting the services to seniors.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, long-term care is about more than just quality of care. It's about quality of life. This government's cuts have resulted in lower quality food in nursing homes. However, with the Premier's fundraising dinner coming up here in November, it costs $300 per person to sit at that table. But he expects nursing homes to feed seniors for far, far less. Some homes have also had to look at increasing fees for services like wheelchair repairs. So, Mr. Speaker, what is the Premier's plan to ensure Nova Scotians have timely access to long-term care with both high quality of care and quality of life?
The Honourable Premier.
Thank you, Mr. Speaker. Unlike the Leader of the New Democratic Party, the Acting Leader in the House, Mr. Speaker, I believe that seniors across this province are getting quality food, and if he believes that there are seniors in this province who are not, he should let our government know, and we'll go into that nursing home to confirm whether he's right, Mr. Speaker, or whether the hard-working people across this province who are feeding our seniors, Mr. Speaker, are doing it in an appropriate way. Mr. Speaker, and furthermore, Mr. Speaker, as the honourable member would know, governing is about making choices. He decided to drive the labour bill up in this province by $700 million embedded in the cost of delivering services. We want to invest in services for seniors, Mr. Speaker, for classrooms across this province to make sure not only are we treating people fairly, Mr. Speaker, but we're treating all Nova Scotians fairly.
The Honourable House Leader for the official opposition.
Well, thank you very much, Mr. Speaker. The Minister just mentioned his EMR project, the electronic medical record, just in the previous answer to my previous question. And that's great, but to the 100,000 Nova Scotians who don't have the family doctor, it really doesn't mean much to them. They really need a doctor or they won't be able to use it. The grim reality is clogging up emergency rooms, causing congestion in hospitals, and producing anxiety amongst patients and healthcare professionals. Janet Knox, the CEO of the Nova Scotia Health Authority, told the Standing Committee on Public Accounts of the system isn't in crisis. So my question to the Minister is, what word does the Minister use to describe our healthcare system that is overwhelmed with a lack of family doctors?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And as the member opposite knows, just since July 1st, that we've been able to recruit about 45 additional doctors. We had an announcement around 23 nurses made up of RNs, family practice nurses, nurse practitioners, in joining with doctors. That group alone of nurses and doctors will in fact look after 14,000 additional Nova Scotians.
The Honourable House Leader for the official opposition.
Well, I could thank him for that answer, but what he also knows is that number doesn't make up for the number of doctors that have either retired or left this province for better prospects in other provinces. Janet Knox said the Nova Scotians are more unhealthy than the average Canadian. In fact, she said Nova Scotians live an average of 1 year less than Canadians and have 2 fewer good years of good health than Canadians. More than 100,000 Nova Scotians, Mr. Speaker, don't have doctors, and they have few places to go for routine checkups or treatment for chronic illnesses. That means Nova Scotians will get sicker and more unhealthy. So my question to the minister is, when will the minister admit that our healthcare system is in crisis and produces a plan that really is going to fix it?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And what I'm able to tell the member opposite and all Nova Scotians, and especially when I hear the stories from other ministers across the country, we have an outstanding system here in our province, and we continue to improve it year over year.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. Last week, I asked the minister to explain, the health minister, explain the confusion about the breakdown of the Liberal cuts to nursing homes and residential care facilities that was obtained through the Freedom of Information request. The minister said that what was provided in the document was an accurate picture, Mr. Speaker. If this is the case, will the minister explain why the document said funding for example, St. Vincent Nursing Home in Halifax was cut by $65,000 when in fact, Mr. Speaker, it was actually cut by $128,000.
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. We know that there are different streams of money that go to nursing homes. We also know that out of that global budget, nursing homes are able to make decisions about how they will operate their facility. I've been in probably about 70 of our 132 nursing homes, and I know that day to day, while there are challenges, I think we need to acknowledge the outstanding work that administrators, that staff, and the quality of life that we have in our nursing homes.
The Honourable House Leader for the New Democratic Party.
We're asking the government to be open and transparent. Just a few days ago, I received another letter from the minister in his department, which only added to the confusion, Mr. Speaker. The letter says the information the department shared was complete and accurate. However, it goes on to say the information that was shared only disclosed the detailed impact list for funding earmarked as 1%, excluding the other budget reductions, Mr. Speaker. So why are they not being open and transparent? Well, which is it, Mr. Speaker? Will the minister explain how the information provided could be considered complete if other budget reductions weren't included in those figures?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And I think the member opposite and a former health minister knows exactly that the 1% will affect a couple of different streams of funding to nursing homes. And what I'm pleased to say today, this started last week, I asked the department to reach out to all 132 nursing homes, the for-profit, the not-for-profit, to give us a very accurate picture at how they were able to handle the reduction, but furthermore, what have been their challenges and what will they need to meet their budgets in the coming year.
The Honourable Member for Pictou Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. Continuing care professionals say that the provincial vacancy rate in long-term care has doubled from where it was 3 years ago. In 2013, the average time it took to fill a vacant nursing home bed was 7 days. As of April 2016, it takes an unbelievable 14 days to fill a bed. As of today, there appears to be approximately 1,253 patients waiting for long-term care. My question to the Minister, will the Minister admit this government is moving in the wrong direction when it comes to filling vacant beds?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. What I'm pleased to say is that the wait list for nursing homes across the province has been cut by almost 50% in the last 3 years. My first report to the House was that collectively,
Order, please. The Honourable Minister of Health has the floor.
Collectively, our 132 nursing homes had 2,650 people waiting to get into a nursing home. Obviously, with the $59 million invested in home care, some people were able to take their name off the list because now they were accessing home care for the very first time, and they're doing very fine at home. But when they need to be on a list, they will certainly get on a list. In terms of the 14 days, that is totally inaccurate. The average time to turn over a bed in a nursing home has again been dramatically reduced. Do we have some outliers? Yes. But we have some now that are turning over to bed in about 5 days.
The Honourable Member for Pictou Centre.
Mr. Speaker, members of the Continuing Care Association estimate that the cost of this Liberal failure is about $70 million. The human cost to seniors and their families is impossible to estimate. The increased vacancy rate also increases the congestion in our crowded hospitals. Question to the Minister, how does the Minister justify $70 million of waste in the system?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. Maybe you can help me out with providing some details around that, because I know that every dollar in our budget is being worked to the best advantage of the care that Nova Scotians need. What I'm pleased to say today is that we are approaching now with less than 1,000 hours of unserviced home care, about 1,250 patients or people on a nursing home wait list, and the lowest number in hospital beds in the last decade waiting to be placed in a nursing home or back home.
The Honourable Member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. Mr. Speaker, my question to you is to the Minister of Health. It's been about 4 months since about 1,000 people gathered in Sydney to talk about the doctor shortage in Cape Breton. 10,000 people without a doctor. Thousands of people are afraid, frustrated, and angry. So my question for the Minister is, will the Minister tell the House and the people of Cape Breton Island what his plan is for people without a doctor in Cape Breton Island? Not the 5 or 10 year wait down the road, but today, as the people who have no doctor today need someone right now.
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I thank the member for the question, because since that meeting, he knows that the wait time for a doctor and a number of patients has indeed gone through an improvement. Just yesterday, we announced for the North Sydney area, Dr. McDonald, who will take on 1,000 patients. Several thousand will be able to access through the new collaborative care in Sydney, adding a doctor to Glace Bay. The member opposite knows that improvements have been made, but we won't get there overnight.
The Honourable Member for Sydney River Myra Lewisburg.
Well, thank you very much, Mr. Speaker. And what this member knows is that there's been 30 doctors that have left Cape Breton. What this member knows is that one doctor on the north side had 2,000 patients, and he thinks that one doctor that's taking on 1,000 patients is going to replace that. This government, that minister, and that premier do not admit there is a problem with health care in the province of Nova Scotia, and certainly with the doctor shortage in Sydney. So the question is, when are they going to act for the people now, not 5 and 10 years down the road? People today that don't have a doctor, Mr. Speaker. People that need someone right now.
The Honourable Minister of Health.
I'm not sure, but you can help me out, Premier. But no, thank you, Mr. Speaker. I thank the member opposite for the question. He knows that that I have empathy with every Nova Scotian who doesn't have a family doctor or what I like to call a primary care provider. Because we all know that in this province, more and more Nova Scotians are very, very satisfied when they go and get the care from a nurse practitioner. And what the member also knows is that since July 1st, we've been able to recruit about 45 doctors, and some have gone to Cape Breton, and others will go to Cape Breton.
The Honourable House Leader for the New Democratic Party.
Mr. Speaker, the government recently announced that all home support wait lists for the VON have been eliminated through the province. While we understand the government is trying to address the needs of seniors, particularly, or the needs of Nova Scotians, particularly seniors, it is important to note that home support services are only one aspect of home care. Home support services include personal care, respite, essential housekeeping, Mr. Speaker. Can the minister explain if the wait lists for home care nursing services, such as dressing changes, catheter care, intravenous therapy, and palliative care, if their wait lists have been eliminated?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And again, member opposite, who is Health Minister, knows how critically important it is to have patients go home with nursing care. And in almost the entire province, it is VON nursing. And the fact that we have the lowest number in hospitals waiting to go home means that we are providing just-in-time nursing for those patients who need higher level of care.
The Honourable House Leader for the New Democratic Party.
So we take that's a no, Mr. Speaker, from that answer. It's important to understand that home care services are meant to supplement the help people already receive from their family, their friends, and their community. However, there's often comes a time when it's no longer possible or even appropriate, Mr. Speaker, for a senior to remain in their own homes. But this government has not opened a single new long-term care bed and have cut millions from nursing home budgets, Mr. Speaker. What is the minister going to do to help seniors who are waiting years, more than 900 days in some cases, Mr. Speaker, to access long-term care?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And as the member opposite knows, as a former minister, that the problem didn't arrive just 3 years ago. We know that the Home First program is working exceptionally well. Other provinces are taking a look at the policy that allowed us to get to a just-in-time home service, and also absolutely we need high-quality nursing homes for when individuals need that level of care. And we now have other provinces that have clearly stated, as the federal government will put $3 billion into home care, it'll be home first, and many provinces will adopt our policies that have put us in the place where we are today.
The Honourable Member for Sydney River, Myra, Lewisburg.
Thank you very much, Mr. Speaker. And Mr. Speaker, my question through you is to the Minister of Emergency, EMO. As we know, Mr. Speaker, it's been a little over a week since the floods damaged thousands of homes in Cape Breton, leaving many people without a home. Families are overwhelmed and don't know where to turn for help. And although friends and family have been very helpful and organizations have helped out and reached out, people are still unsure of where to turn. So my question for the minister is, will the minister please update the House as to what services are available to those people who have lost so much in the Thanksgiving Day flood.
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. And we are so well aware of the devastation that's happened to people's lives, to their property, the disruption that people are experiencing, and we want them to know that along with all the MLAs I know on Cape Breton Island, their government stands fully behind them. We have initiated and expedited the disaster relief program, Mr. Speaker, so that will see millions of provincial dollars flow in to the affected area. Each individual household will be able to apply for up to $200,000 in financial support, Mr. Speaker, and you know, we will start seeing those dollars move out. We are working with the United Way to ensure that the immediate emergency needs of people are taken care of, whether that is lodging, food, or any other expenses that are needed. And if those dollars are depleted through the United Way, we will and have committed to flowing more to them.
The Honourable Member for Sydney River Myra Lewisburg.
Thank you, Mr. Speaker, and thank you for that answer. Mr. Speaker, there is no doubt that the need is great. With winter on the way, it's very important that families get settled in safe, warm homes. And Mr. Speaker, the weather is predicting another devastating rainstorm this weekend. So my question for the Minister is, will the Minister tell the House how many staff members from EMO are on the ground in Cape Breton, and how long people can expect to wait to have their applications processed?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. The application processes are being expedited. This process has never worked as quickly as it is now, and our intention is to ensure that that continues and that the money flows efficiently to those who need it, who need the dollars to help rebuild their lives. Mr. Speaker, we are investing additional dollars into human resources so we have more boots on the ground in Cape Breton. We have sent information packages out to all the MLA offices and to the municipalities with a fact sheet and a step-by-step list of things that people need to do during this situation. We know how stressful it is, and we want to make sure people have the best information possible and know that their government and all MLAs are standing behind them and will continue to stand behind them through this process.
The Honourable Member for Northside Westmount.
Thank you, Mr. Speaker. Mr. Speaker, my question is also to the Minister responsible for the EMO. Thousands of people have been impacted by the floods in Cape Breton. Nearly 1,000 people now have registered as flood victims through the CBRM helpline. They're looking at the form for disaster relief, but the form requires a $1,000 deductible. I'll have that form here, Mr. Speaker. Can the Minister for the Emergency Managers Organization please provide the people of CBRM with an explanation about the $1,000 deductible for the disaster assistance for residential properties?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. As I mentioned in the previous answer, we have actually upped the cap of eligible dollars for people to apply to their private homes and the damage. We've increased that cap from $80,000 a household to $200,000 a household. And of course, we do not want there to be any obstacles, administrative or financial or otherwise, to slow down the process of these individuals getting that money, which is why, Mr. Speaker, we are eliminating that $1,000 deductible for the people on Cape Breton Island.
Member for Northside Westmount.
Thank you, Mr. Speaker, and I thank the Minister for that question. We know there is more weather on the way for tomorrow that could see more localized flooding. People are worried, Mr. Speaker. There is already mass confusion and chaos about how to even apply for the funding. Will the Minister commit to getting that information he just tabled here about the $1,000 deductible directed to the people of Cape Breton in need?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. So through the National Disaster Relief Program, that $1,000 is a federal figure, but provincially we are going to eliminate that requirement so that nobody on Cape Breton Island will be required to pay that deductible. And now that the cap has been increased to $200,000, you know, we expect that to be very helpful for people who are trying to rebuild their properties and their lives. And Mr. Speaker, if the member has any specific concerns related to this process, please direct them towards my office. We will do everything we can to make sure people have the information they need and that this process moves as quickly and as efficiently as possible so that people can begin rebuilding their lives.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. My question today is for the Minister responsible for the Advisory Council on the Status of Women. My caucus and I have significant concerns about the emphasis this government has placed on home care services while cutting funding to seniors' homes. Home care services are meant to supplement the help people already receive from their family, friends, and community, and often this means a reliance on unpaid caregivers, most of whom are women. So my question for the Minister is, has she or her department analyzed her government's reliance on home care while cutting long-term care in order to determine the impact that this decision has on Nova Scotian women providing unpaid care?
The Honourable Minister of Community Services.
Thank you. Thank you, Mr. Speaker, and I thank the member opposite for the question. It actually came up at a federal table not 2 months ago about unpaid care that women across the country are often responsible for, being maybe an older daughter or an unmarried daughter. That was certainly a topic as well. What I do know, we have not had any discussions coming through or being funneled through the Advisory Council. There have been no calls from women or groups that are concerned about any situations within home care. I do know, speaking with elderly women in this province, is that they want to stay in their homes and they want the home care to be in their home, and where we've alleviated those wait lists, their needs are being met. So we have not done an analysis because it has not come to our attention.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker, and I thank the Minister for her response, and I wonder if she might ask her government to take a look at that as well. Mr. Speaker, it's estimated that the labour of unpaid caregivers in Canada is equivalent to about $25 billion a year to the healthcare system. When women provide unpaid care, they're more likely than men to be responsible for care that's more intense, more frequent, and generally more stressful. So with our aging population, many women are concerned, and I am hearing from them in my office about increasing expectations for them to take on additional caregiving roles. So my question, Mr. Speaker, for the Minister, as the government places more emphasis on seniors staying in their homes longer, what actions will the Minister take to ensure that this does not place an unfair burden on women to provide unpaid care?
The Honourable Minister of Community Services.
Thank you, and I thank the member again for the question. One of the things that I have brought to this position in my role as Minister responsible for the Advisory Council is that for the first time in the history of the province, we actually have gender-based analysis within the Department of Community Services and the Executive Council. That started a year ago. We have training that happens across the board in terms of government on what the effect is on women. That analysis is in the infancy of being done across government departments. It's a huge project because it's never happened in the history of Nova Scotia. I'm pleased to bring it to Nova Scotia, and it's been well received by senior civil servants within the bureaucracy.
The Honourable Member for Pictou West.
Thank you, Mr. Speaker. Mr. Speaker, the number of seniors occupying acute care beds in our hospitals is a real problem. I know it is at the Aberdeen and Pictou County. These seniors deserve to receive the proper care at home or in a facility that's tailored to their needs. Furthermore, Mr. Speaker, acute care beds are meant to keep those with the most complicated issues in need of constant medical attention. The fact that the government cannot place seniors in a more comfortable, appropriate setting results in overcrowding of ERs and unnecessarily long stays in the hospital. What is the Minister of Health doing to free up space in hospitals so that seniors awaiting placement can receive the appropriate care?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And this is an area that over the past 3 years that a significant improvement has been made. At one time, we had about 150 patients at the QE2 alone waiting to be placed back home or in nursing homes. We are now down to about 150 for the entire province. And in terms of the Aberdeen, at any one point in time, we can have a few more in an acute care bed than certainly what our goal and working towards is being realized. And if there is a concern at the Aberdeen, I'm sure I'll hear about it.
The honourable member for Pictou West.
Thank you, Mr. Speaker. There is a big concern in Pictou County, and that's what I'm trying to express right now. The cost per day of a long-term care bed in a nursing home or residential care facility is $300 versus $1,100 a day in an acute care bed in the hospital, and I'll table that. Mr. Speaker, not only are these seniors not comfortable and able to socialize and start a new home, it is very costly to the taxpayers. Seniors pay their taxes and have contributed their whole lives to have the care and comfort they deserve. The government should have the foresight to plan ahead. So my question to the minister is, how many acute care and emergency room beds are currently occupied by individuals awaiting transfer to a more appropriate facility, and when will they make that transfer?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I'll certainly provide the member opposite with the number as of today that are at the Aberdeen waiting for placement, either in long-term care or to go home. And as the member opposite knows, that more and more are going home because there's no wait list for VON nursing. And in terms of other supports, as the member opposite knows, the wait list for home care in Pictou County has also been eliminated.
The honourable member for Pictou East.
Thank you, Mr. Speaker. My question is for the Minister of Health. It's recently been made public that health ministers from across the country have agreed to switch Crohn's and colitis patients from their current medication to a generic. And there is no cure for these diseases, thus medication is not a one-size-fits-all. Many patients go through countless bouts of trial and error before they find something that works. So my question for the minister today is, does the minister plan to force patients and doctors to switch carte blanche from their existing prescription to another prescription, cheaper or not, knowing that it could have a negative impact on their health?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And if I haven't said this publicly, maybe the legislature is a good place to make this statement. I reached out to one of Canada's experts who happens to be here at the IWK, Dr. Otley, and we will have a no-switch policy. Those who are currently on Remicade will stay on Remicade.
The honourable member for Pictou East.
Thank you.
The honourable member for Dartmouth South.
Now you've got an answer period. Mr. Speaker, my question is for the Minister of Health. An individual in my riding is concerned about the increasing costs of long-term care for their father. The Department of Health and Wellness is supposed to provide 30 days' notice of any increase in fees for clients in long-term care. Today is October 20th, and new rates are expected to go into effect November 1st. However, notices of assessment were late being processed this year, and in some cases have not yet been received. Mr. Speaker, my question for the Minister of Health is, if clients have not received letters from the department, are they still expected to pay increased fees for long-term care on November 1st?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I'm pleased to give the member opposite more good news. There will be no increases this year.
The honourable member for Dartmouth East, or pardon me, Dartmouth South.
That's interesting, Mr. Speaker. That will be very interesting and happy news for my constituent. But over the past 2 years, this government has made significant cuts to long-term care. My constituent was paying $998 per month for long-term care. As of November 1st, he'll be paying $1,220, which is an increase of over $200 per month. Any increases in fees have a huge impact on families. Most Nova Scotians are not like those who recently paid $1,500 for a ticket for a fundraiser with the federal finance minister. $1,500 is my constituents' total monthly income. So, Mr. Speaker, can the minister please explain why the government is paying for less for long-term care and clients are paying more?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. What I was alluding to, of course, in my first response was that there will be no general increase in fees for this year, but we all know that there can obviously everybody's assessment comes back each year. There can be a change in that personal assessment where additional income was realized in one way or another. That could obviously change. As we know, there are different rates for residents in nursing home, and so I would have to look at the individual case to determine if there is some anomaly that is going on.
The honourable member for Colchester, Musquodoboit Valley.
Thank you, Mr. Speaker. My question is for the Minister of Health and Wellness, and I hope he's still on a roll. Last summer, Edgar and Teresa McPhee were forced to move into different nursing homes. And at that time, the minister said he was very sympathetic and would look into their file. More than a year later, we have another couple, Etienne and Delima Sampson. They're facing the same problem. While they have waited to get into the same nursing home, they've missed Etienne's 92nd birthday, their latest wedding anniversary, and also the grieving of the death of a grandson. So my question is that couples in their 80s and 90s don't have a luxury of time. What is being done to accommodate couples in the same nursing home?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and to the member opposite for what I consider to be very personally that I started about 10 years ago advocating that regardless of the level of care, that husbands and wives, partners remain together in a nursing home. And during my time in office, as the member stated, we have looked after those cases that have come along. Unfortunately, sometimes they're brought forward through the media because they time sensitive and so on, and perhaps the department hasn't dealt with them. In the case of the Sampsons, we need to realize that one is in a nursing home and the other is not in a nursing home at this point in time. And with Mrs. Sampson, who is in a nursing home, she's on a list to get transferred back to Richmond County.
The honourable member for Colchester, Musquodoboit Valley.
Thank you, Mr. Speaker. I had the luxury of my sister coming home and looking after my parents at home. Very, very fortunate, but a lot of couples don't have that luxury. That's for sure. So, has something actually been put in place where putting those couples in the same nursing home is a priority?
Honourable Minister of Health.
Thank you, Mr. Speaker, and thank you to the member for the question. I guess in terms of a policy, we are working towards that goal as cases come along. But what I can tell the House today and all Nova Scotians is that this will be addressed with great clarity in the new continuing care strategy.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. Documents obtained by our caucus show that this government eliminated all non-emergency capital funding for nursing homes and residential care facilities in February 2016. A letter sent to the long-term care facilities by the Department of Health and Wellness stated, given the current fiscal environment, only emergency requests will be reviewed at this time. This position was reaffirmed, Mr. Speaker, for 2016-17 in a memo on May 12, 2016. Does the minister believe it's acceptable to balance the books by putting at risk the state of our nursing homes across the province?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. What I'm pleased to convey today is that when there are emergencies in homes across the province, the request is made to the department, and if there are any homes that haven't had that determined that it is an emergency requirement, then I would certainly, personally, as Minister, look into those situations.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. There's a trend with this government around cutting funding for infrastructure, not only in long-term care but in other health facilities, Mr. Speaker. In May, a Global News investigation found this government had underspent the hospital infrastructure budget by 50%, or $72 million over the past 3 years. A month later, in June, the Auditor General raised concerns about inadequate funding for hospital infrastructure, Mr. Speaker. When will the government lift the restrictions on capital funding for nursing homes in this province?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And with the current work that the department is doing in contacting every nursing home on an individual basis to assess the current operational needs, needs that perhaps are short-term in regards to one of their appliances or long-term structural needs. We'll have some of that coming at us very quickly as we prepare for budgets next year.
The Honourable Member for Inverness.
My question is for the Minister of Transportation. A slope failure on the East Margaree Road has become such a problem that traffic has been reduced to one lane, and traffic lights have been put up for safety of motorists. Previous attempts to fix the road have not been successful because the slope continues to erode. Earlier this year, the Minister commented that the government would fix it this year. Can the Minister confirm that the road will be fixed?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and I thank the member for the question. Without question, when the member and residents from the area brought this to our attention, became a priority for the local area, our department and the staff that are on the ground there. We are committed to fixing it, and if time requires or allows, we'll be doing it this year. There's no financial constraint on that project. We're going to do it. We have to do it. It's necessary, and we're going to do it as soon as possible. So if we can do it this fall, we certainly will. It's a very significant project. The road has to be realigned, so there's design requirements that we have to proceed with, and as well we have to cut away the slope and basically completely realign the road. So we are committed to it. I can tell the member and his residents, the people he represents, and we'll get it done as soon as possible. We truly hope that it will be this year.
The Honourable Member for Inverness.
Thank you, Mr. Speaker, and thank you to the Minister. It has certainly been frustrating for local residents, people traveling through the area, and it will be welcome news for the people of East Margaree to hear this. Mr. Speaker, the Minister hasn't framed up the exact time by which the project will be completed. Can you provide some details, perhaps, when the tender will go out for this construction?
The Honourable Minister of Transportation.
I can thank you, Mr. Speaker, and thank the member for the question. I can certainly get that information today, and I can report back to the member in the House by the end of the hours here at the House by the end of the day today. Thanks.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. The Ally Centre in Cape Breton has received funding from the Federal AIDS Communication Action Fund for over 24 years. Just a few weeks ago, we've learned the federal government's decision to withdraw funding from the Ally Centre. Among other critical services, the centre runs a needle exchange program across the island. Cape Breton has some of the highest rates of hepatitis C in the country, and 1/4 of the cases here in Nova Scotia. 70% of those cases are attributed to people sharing equipment to inject drugs, Mr. Speaker. So I'd like to ask the Minister, will the Minister of Health please explain what this government plans to do to prevent the potentially devastating effect of losing these services on Cape Breton?
The Honourable Minister of Health.
Thank you for the question, and Mr. Speaker, I'm pleased to say that I have visited the Alley Centre, and it's a good time and place to commend the staff there who do exceptional work. Their compassion, their professionalism is really to be commended. Working with some very difficult cases, and with the loss of federal funding, we have to now do a review of what their needs are in the short term and the long term. It is a very important service to that community.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. It is the responsibility of the Nova Scotia government to protect the health and well-being of its citizens. The Ally Centre was one of 2 sites in the province to receive funding for a pilot program, Mr. Speaker, to provide naloxone and anti-overdose kits. Cape Breton Island has the highest rate of opiate overdoses per capita in Nova Scotia. These kits are key to preparing for a possible public health emergency caused by the increase that we see across the province of fentanyl use. So I'd like to ask the Minister, how will the government ensure that the loss of federal funding does not negatively impact the naloxone program being run out of the centre in Cape Breton Island?
The Honourable Minister of Health.
Thank you very much. And Mr. Speaker, what I want to convey here is that we know in Nova Scotia we have to be proactive regarding fentanyl, carfentanil, possibly coming here into the province. There has been some, of course, picked up off the street, fortunately very small amounts. And in order to be proactive, I have given the task to Dr. Strang to look into all of the areas regarding methadone and Suboxone, naloxone, all of that whole area, to make sure that we are doing enough to protect those very vulnerable citizens.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. I've asked this question, I would say, for the last 5-6 years. To different ministers in this House, and I know I've asked the Minister of Health here about this one as well. And it revolves around the issue of oral cancer medications. So basically oral medications that you can bring home to treat your cancers rather than receiving the intravenous kind. So my question to the Minister, has he reviewed it, and will he be funding at-home cancer medications?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And to be fair to the member opposite and all Nova Scotians, a few seconds will not allow me to explain what is actually taking place in regards to the review.
Order,
and I'll be pleased to report.
Time allotted for oral questions put by members to ministers have expired. We'll now move on to government business. The Honourable Government House Leader.
Thank you, Mr. Speaker. Would you please call public bills for second reading?
We'll now call public bills for second reading.
Mr. Speaker, would you please call Bill number 22, the Halifax Regional Water Commission Act?
Now call Bill number 22, the Halifax Regional Water Commission Act. The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. I'm happy to move this bill forward through second reading. To clarify for the sake of the House, there are 3 main changes that are included in this proposal. One, we are clarifying that HRM Council has final authority on the business plans that are developed by Halifax Water. That is to ensure that the business plan of the Halifax Water Commission is in line with the desire and strategies of Council. We are also moving the Halifax Regional Water Commission, Mr. Speaker, to a competency-based board. Previously, the majority of seats on the board were made up of members of Council. Council has wanted to change that, so members of Council